rapid fire. Our first rapid fire session is with Sara Griewank. She is the Chronic Respiratory Disease Section Director at the Indiana Department of Health and a good advocate for the state of Indiana. Sara is going to be sharing information to help address asthma triggers. And so, Sara, I am going to turn it over to you.
All right, good morning, everyone. Hopefully you can hear and see my slides in presentation mode.
We're not seeing your slides in presentation mode yet.
Okay, let's see here. Let me stop sharing here and try one more time.
Technology is great.
Well, I have 3 screens and it popped up in 3 different ways. So how about now?
Yes.
Perfect.
Thank you.
Awesome. Awesome. Okay. Please interrupt me if anything changes. Thank you so much for allowing me to share with you today. Again, my name is Sara Griewank. I am the Chronic Respiratory Disease Section Director within the Indiana Department of Health. Let's see if it will advance for me here. There we go. Quickly, here's our mission and vision. So just a reminder of what asthma is. It is a chronic lung disease characterized by inflammation in the airways, narrowing, as well as some increased mucus production, which makes breathing really difficult. It can be severe or life-threatening for patients whose asthma is not well controlled. We can partially define control by level of understanding, as well as how often a patient is experiencing symptoms and their knowledge base and control with triggers. I like this image here and kind of liken it to different straws, your normal airways, your nice big kind of the smoothie straw or the ever popular boba straw. An asthmatic airway, you're moving down to maybe a more normal soda straw, and then that airway during an attack I liken to that cocktail straw that's pinched down the middle. So if you can imagine trying to sip a smoothie through a cocktail straw, that's kind of what it can feel like for a person with asthma during an attack. Some numbers. Approximately 1 in 10 Hoosier adults and 1 in 16 Hoosier children currently have a diagnosis of asthma. And almost 30% of adults and children are missing work and school because of their asthma at least one day in the past year, as reported through the Behavioral Risk Factor Surveillance System, or BRFIS. It's a leading contributor to school absenteeism. Quick look at our ED visit rates. We are seeing a trend downward to 26.2 as of 2020 per 10,000 residents, down from 39.3. You know, it's kind of easy to hypothesize just looking at the years at which we were seeing this sharp decline, but we're not quite there yet of being able to say what could or could not have contributed, though we are doing lit reviews to determine some of those factors that could be at play. Similarly, with our inpatient hospitalization rates looking across time from 2010 to 2020, we see that downward increase. From 2015 to 2016, we see that line there, and that is due to the coding change, the ICD-9 to ICD-10 coding change. But as of 2020, we are looking at about 2.1 per 10,000 residents for our hospitalization rates. Mortality, we do unfortunately experience a number of deaths throughout the state of each year due to asthma. This is a primary cause of death as listed on the death certificate. Collectively, lower chronic respiratory diseases is consistently in the top 10 causes of death throughout our state, making the programming that we do fairly critical. And there are some ways that you can help out, which we'll get to shortly. So looking further, this is for adults responding to the BRFIS asthma callback survey. If they've had missed work days or activity limitations due to their asthma, and about 38% have limited their usual activities in the previous month due to asthma, and 65% are reporting that their asthma is caused or made worse by their job. And one that I want to highlight here at the bottom, about 48% of Hoosier adults are reporting a medical diagnosis of depression due to their current or former asthma status. So, kind of a key factor to keep in mind there when we are working with our patients with asthma. So like our other chronic diseases, though asthma is one of the most common long-term chronic diseases throughout the US, we do see disparities in Indiana. And here's some numbers for you. The burden of asthma falls disproportionately on our Black, Hispanic, and Native people. These have been identified in prevalence, mortality, as well as utilization rates of healthcare along racial and ethnic lines. We see asthma disparities in our asthma rates along income as well, with almost about 41% of all current asthma cases throughout the state seen in residents with an income less than $35,000 per year. In our state, multiracial Hispanic and Black Hoosiers have a higher prevalence of current asthma rates. And when you look at sex, women have higher rates than men. Our Black Hoosiers have a higher number of asthma-related ED visits than their white counterparts, while also seeing a greater chance of mortality. So how is asthma controlled? Well, our program, the chronic respiratory disease section, we are currently funded via the CDC to do focused deliverables for asthma. And we really need to take a clinical and environmental look at the disease. And we need those two components to work together, making that a more holistic approach. So as part of that, we have what CDC calls exhale, each letter standing for a component of our best practices, each strategy. So the first being self-management education. Do patients understand their disease? Are they able to recognize their symptoms, identify triggers, and know how to use their medication, both controller and emergency medications? Extinguishing our X. We want to make sure that our patients with asthma are either working, if they're smoking, they're working towards cessation, or if they're non-smokers, and particularly our children, reduce exposure to secondhand and even third-hand smoke. Bringing in that environmental component, looking at the home, working inside the home to assess for triggers, identifying ways and educating and supporting the patient or the family on reducing those triggers to help prevent exacerbations. The A, achievement guidelines-based medical management. L, linkages. This is really, sorry, they must be on a timer here. This is where we want to make sure our social determinants of health being met. You know, if they're in a home, is it a healthy home? We have a big push and a lot of discussion about access to affordable housing. It's not a healthy house, it's not an affordable house, but do they also have food so they can properly maintain their health? Do they have transportation? All of those factors. So making sure that across settings, we're getting them linked to the appropriate resources. And then if possible, having a bidirectional process so that we can make sure that we're working as a cohesive unit in patient care. And then that second E is environmental policies. This can be big P or little p policies. Big P, looking at larger community, locality, or statewide policies, but really our small p, are our facilities smoke-free? Are our campuses smoke-free or tobacco-free? Those types of things. So one thing that we are working to promote and expand is a home visiting program. So for those patients who may be coming into the emergency room fairly frequently, or they're requiring one or more hospital stays a year for their asthma, if it's not something that we're controlling with medication changes, we need to look at that next step and look inside the home, look where they're spending their time. Approximately 90% of our time is spent indoors. So we utilize, it's an EPA, HUD, and CDC co-branded checklist. We have training available through IDOH, as well as CDC just came out with a training program for anyone who serves in a home visiting capacity. You know, we target kind of community health workers, but really anyone that goes inside the home and provides services can run through a training on this checklist. And really what you're doing is you're walking through room by room through the list. It's pretty prescriptive, and you're seeing, do we have visible mold? Can we see if there's visible moisture? Are there pets in the home? Or they may not be considered pets, but are there animals in the home? Do you smell tobacco smoke? Pest management. And for each trigger that is identified, there is suggested mitigation techniques on that checklist. And that can be done in partnership with that resident, with that family member, and education occurring at that time. So really, what we ask you to do is familiarize yourself with the checklist. Contact us if you have patients that you feel could benefit from this service, or just make sure that the patient or family is aware of environmental triggers and their effects on asthma, and they can reach out to us and we can make sure that they get a home trigger assessment completed free of charge. Here are the resources we used. And here's my contact information, so please don't hesitate to reach out via email, or you can also get to me through Joyce or Becky. I'm happy to answer any questions or reach out and I can get you any resources. Thank you so much.
Thank you,
Leave that
Sara.
up for just 1 second in case you need to get my email.
Thanks, Sara. One question is, do we contact you directly for the training?
Yes, please feel free to give me an email and I'll get you connected with the right links.
Okay, thank you. And on your resource list, which one of those is the actual checklist?
Let's see here. The image might be hyperlinked. I will make sure, let's see, down on the bottom of the screen there, this screen, there's that tiny hyperlink. You can get to the checklist through that URL. Or I can also email and Becky, I'll provide you with a link to the direct PDF.
Perfect. And we'll send that out with the recording of the event.
Fantastic.
Any other questions for Sara?
Becky, I have a question. Sara, do you have a feel for how the fire enrichment on April 11th has affected those with asthma at that recycling plant?
You know, I can't speak officially as air quality is not within my purview. I think we can all make some assumptions that there's negative impact, but I think until they complete their analysis and release some more findings from that, it's hard to speak. That falls more in IDEM as far as the air quality in that.
Thank you. Kathy, any other questions on your end?
No, thank
Okay.
you.
Thank you.
Thank you so much.
Thanks, Sarah. Appreciate it. At this time, I'm going to turn